about us. Think about you leaving.
What's going on? How is everybody this evening? I see Foxy Moxy's in here. Debbie, good evening / morning to you. Roel, what's going on? Rhonda, hello. Thank you for the question. And thank you for coming into our Johnson City office. Super cool. Shout out to Performance Medicine in Johnson City. Who else is with me? We're going to let a few more people come in here tonight. As you guys know, we have Andy Rogers answering questions this evening. So, Debbie, this is perfect timing. Thank you, Debbie, for the question. Edna, hello. Lato, what's up? Great to see everybody. Thank y'all for hanging out with us this evening. I'm going to make sure we are live everywhere we need to be live. You guys can see me on Facebook. I think you can see him. Zach, what's going on, man? So good to see you, brother. Such a great job on all these, on all of our videos, man. We really appreciate you. Kim, what's going on? Great to see everybody. Let's see. I'm going to try to figure out my mic situation. Robin, what's going on? Your audio was so good that it could not have made my audio look worse. That was the only downside to this week's Explain This. It was an incredible show, and your audio was just so good that it made my audio look like, you know, I was in the middle of Manhattan and, you know, and nobody, like my audio sounded like it was, you know, I was in my car with earphones. But yes, I'm learning. I got my setup here. Never making that mistake again. Thank you. I see Grandma Mary in here. Grandma Mary, what's going on? Great to see you. I love you. Speaking of this week's Explain This episode, I'm going to put it up here for everybody to see. If I can find it. There we go. Newest episode of Explain This with the star of the show, Robin Riddle, talking about melatonin. If you thought melatonin was just for sleep, then you need to watch this episode. And Robin goes over all the different health benefits to supplementing with melatonin, as well as the way our own body produces it. It was a super fun episode to do. Thank you, Robin, for all that information. And then we also had another, a brand new Common Sense episode up. As you can see there, that's Dr. Robert Russell talking about forgiveness is medicine. This is a powerful episode, everybody. Talks about the healing power of forgiveness. And I actually I was going to do a reel on this today because, one, it's so interesting how unforgiveness can impact our physical health. And Dr. Russell does an incredible job of explaining that. Dr. Rogers does also an amazing job of talking about some of the more, outside the box, ways of getting healthy. So thank you guys for doing that episode of Common Sense. I think Andy is on his way. I can see him moving through the green room. Andy, give me a thumbs up when you are ready to go. All right. I see questions coming in. Thank you guys. If y'all have a question for Andy, go ahead and put it in the comments. Let's see if we can get Andy up here. Hey.
Yo, hey, it feels good to be back.
Dude, I am so glad to have you back on the show. It's good to see your face. I see, who do we got? Introduce her.
This is Virginia. Y'all have not met Virginia. Virginia is hanging out with me. She's going to do the questions with me today. I'm representing North Knox.
There we go.
Baby, what? Bobo in the house. What? Yeah.
I love it. I love it. North Knox represented. We got Virginia in the background. As you know, Andy, this is a very, we got an audience here that loves our dogs. So I'm glad Virginia is with us this evening and going to be helping us out with the questions. I
Oh,
see here
totally.
we're getting tons of comments. Look, Edna's so glad you're
Roel's
here.
here. Oh, Edna, I can't even. I can't even. And Roel, I haven't been on here in forever. Can you also see me while I'm looking at these comments? Yes, you can, because
Yep,
I can
yep,
see.
yep.
This is insane. I feel like Ben. It feels like coming home. Is Kiki on?
Kiki is on. I'm gonna find Grandma Mary here. There we
Oh,
go.
Kiki, I miss you, Kiki. I'm coming to visit soon. Okay, I
Real
just like yes.
quick. We got San Diego in the house. San
San
Diego, what's going
Diego.
on?
Oh my
I love
God,
it.
San
I wanna
Diego.
go. I wanna go. Uh,
Ben, I lived in California for 3 years and you never came and saw me.
and I've told you, I tell you this every time I see you. It's like that's one of the bigger regrets of my life. It's not
That
going.
it's one of them. Okay, then
It
we have a
is.
lot. We have bigger fish to fry if that's like the worst thing that you've ever like. Yeah, but
No,
still, that's very. I mean, that's very sweet. It's
I hate
okay. I
that.
did have a
I hate that.
whole. I had like a
I
whole life out there.
I know,
Like, do
and
you
I missed it.
remember?
I missed it.
Yeah. Do you not remember?
Well, we got a great crowd in here. Terry's in here. Terry, what's going on,
Terry,
brother?
is it Terry Graybill? I'm
Oh
trying to
yeah.
read these at the. Oh, Terry's in the
Oh yeah.
house. D. Lynn in the house. Is Robin in the house? Robin
Robin
Riddle?
Robin is in the building. Robin is
Thank.
in the building.
Do you know what I
Uh,
say? I always say, thank God.
yeah. Robin, can we please get help with the questions?
If I don't know, Robin, Robin will know. I say that very genuinely. Oh,
I see
Angie.
you, Angie.
Oh, look at her sweet grandbaby in the
I
house.
see you, Tabitha.
Oh, that's that front. That's that front over in Kingsport causing
We
trouble.
got a
That's
great
that.
crew here
Yes,
tonight.
this is a good crew, and Julie, this is a good crew. I'm telling you, Robin. Like we're thank God. Okay, thank God. I have. Robin is so intelligent. I covered for Robin one day. I always feel like it's a big compliment if I cover for providers and they won't see me. This one lady was like, no.
No,
I was like, I mean, I can like kind of help. And the just like, no,
they're like,
I'll reschedule. I'll wait. I'll
I'll
wait.
wait.
I was like, that's the biggest compliment. I was like, we've got
I'll
such
wait.
great, smart providers, and I've had that happen with multiple providers. Amber, same thing
Yep.
happened with Amber. This lady came in and left. I mean, which is a big compliment. That's just to say that people get really attached to their providers, and we're very, very lucky to have a good team. Even Dad sent out a text the other day to our provider thread. I mean, if for those of you who don't know, we are all on one group thread. We share HIPAA compliant information, so none of your names or ages, yes, but names or identifying information goes on these group threads. If someone doesn't know, if you don't know in the rooms, most likely somebody knows on this thread.
Yep.
So you at least have 11 people looking at your case if the provider in the room you're seeing doesn't know, which I really like that we kind of work together to do that.
Super cool, man. We got such an amazing team, and you guys do such a great job of feeding off of each other and learning from each other. You know, we do. You put on 2 conferences a year with our providers, just continuing ed. So it's super cool to see. It's really inspiring. I see. Look at this. We got Hive Mind in the building.
Hive mind, baby. Hive mind, get that beat. Oh, that's like Beyonce.
Edna's upset, and I get it. I get it.
Edna, I'm gonna tell you, Edna, you're in the house with me. All my cups, I got all my cups in the house. Edna gives me cups and socks for the holidays, so I have all of them with me. So Edna, you're kind of with me all the time.
Edna, we love you. We love you. Thank you for being here tonight.
How is your knee?
My knee's getting better, man. My knee's getting better. Had a little.
I meant Edna, but I'm sorry. Yes,
Oh.
how was your knee too? Is your knee good? I'm glad. I hope it's
No,
good.
Edna comes first. Edna comes first. Edna, how is your knee? And
I
then
hope Edna's knee is okay. But Ben, is your knee okay? Do you
My
need
knee-
something? Do you need a band-aid for that boo boo? Yeah, have you told this audience too about your stitch?
no.
Okay, so Kelly and I, growing up, Kelly and I were more accident prone. And so we got in accidents and had stitches, and I've had 22 stitches across
Yeah.
my neck. I've broken arms. Ben was the more cautious kid, and he really wanted a stitch. And Ben kind of banged his head on a brick.
Not on purpose. Not on
Not
purpose.
on purpose, but he's like, oh, I think I need a stitch. Dad
No.
goes, fine, and throws in one stitch into the scalp. We called him Stitch for a little bit. Little
Yes.
Lilo and Stitch.
Stitch stuck to this day. That was 30 years ago.
Oh, hey, Bo's in the house too, y'all.
Is Bo in
Bo's
the house?
Hey,
There
I
he
told
is.
Bo, I was
There
like,
he is.
he's getting on. Bo's getting on here.
I love it. He's gonna get on here.
He's gonna get on here and he's gonna answer some of these questions.
Bo, here we go. We're ready, man. We're ready. Okay, I see Linda in the house. Linda, what's going on? So good to see you. Seems Edna got PRP in both knees. Let us know how it's going, Edna, with that.
Nice. PRP, platelet-rich plasma. Get it. We're hoping to bring that to the Knoxville area.
Yep.
By having my machine down there, we're not sure. Oh my God! I haven't seen you in forever. Yo, these are good times.
Guys,
It's like a high school reunion. This is great. This is great.
We're going to get to some questions here. If you have questions for Andy, go ahead and put them in the comments. We had a few come in throughout the week. We appreciate you guys sending in questions. That gets our show started. This one here is around Butyrate. Is Butyrate safe for anyone to take for gut health, and what dose is recommended? What's your thoughts on this?
Big booty. Ben, I think it's Butyrate, not Butyrate.
Butyrate.
I'm sorry, I just couldn't help it, but Butyrate. Ben, you do so. I'm kidding. I'm trying to make you laugh. I'm trying to make everyone laugh. You pronounce things great, and I might be doing it wrong, but I think it's Butyrate.
Butyrate.
Okay, Butyrate. Is Butyrate safe for anyone to take for gut health, and what dose? Okay, so I would probably say yes, and Robin may have some comments on this too. Robin and Bo actually in our North and West Knoxville clinics do GI maps to look at leaky gut, and that's what I think about when I think of Butyrate. And so Butyrate is I believe a fatty acid, like a short chain fatty acid that is produced in the gut during the fermentation process. So like food comes in, Butyrate goes on the mucus lining of the gut, and that actually feeds I think it's like, I don't think they call it colonics, but it feeds the bacteria in the gut. So it almost works like a pre or postbiotic. It's not a bacteria, but it's part of that gut lining. So people use that for leaky gut. And I believe it's part of the mucus. Like your gut is really slimy going down, and it's full of this mucus and these small villi that go like this, and that all have bacteria on it. So all that lining works together to say, what is the food coming through? What do we need from the food? And what do we don't need as waste product to send it down the line? And including how we get water into our system as well. So Butyrate, I think, is great if you're thinking about leaky gut. I wouldn't necessarily say that if you don't have gut issues, you need to take it. I would say take it if you have gut issues and see if it helps you out. I believe it's testable to see if you have enough butyrate, and I would venture to say that butyrate can be affected with a autoimmune gut, a leaky gut, a poor diet, can actually decrease or affect the levels of butyrate. And so I think that the answer to this is yes, it's probably safe for most people to take. Dosing, I think it's 150 to 300 milligrams. I think. And I believe there's a Body Bio supplement that is a butyrate. And I might get Robin to comment on that to see if she has any recommendations on specific doses for butyrate. But I think that, yes, I think it's safe for anybody. I would do it if you have gut issues. And think about it for leaky gut or autoimmune gut. And leaky gut, we can test through a GI map. You can look for zonulin leakage. It's kind of a signifier for, and leaky gut just means that the junctions are loose. And the idea behind adding butyrate to your diet is to get the junctions back together, to get the mucus to make it come back together so that things don't fall through the cracks. When you have leaky gut, things are apart and things can fall through, and your body thinks it's a foreign invader, and you start having these autoimmune issues. So that's how I'd look at it. But not a bad thing. Another thing people are doing for the gut is Akkermansia. Akkermansia is they're saying is the new save all prebiotic. So not a bad idea to look at Akkermansia too. But that's a bacteria. This is not a bacteria. Short chain fatty acid dealing with mucus.
Seems we got the
Yes,
dosing
it does.
right
Okay,
there.
so
Thank you,
about
Robin.
150 to 300 milligrams daily. And for whoever's asking this question, I would say I always think about when you're adding a supplement, any supplement. I'm always thinking, what am I adding it for? Do I have like a preliminary symptom as a litmus test to see if this supplement's actually making me feel better? Am I making an investment for my long-term health, knowing I may not feel immediately better? Like, a lot of people feel immediately better with vitamin D, but I think that's an investment for the long run. That's just
Mm.
great for your immune system. And then two, you can also see, do I notice a data change, like a data point change? And butyrate would be one to say, I have a litmus test that my gut was off, and if I had either IBS combination of constipation diarrhea, I have gut discomfort, and I take butyrate and I feel better. So that would be my litmus test for it.
All right,
So
great
good. That's a
question
really good
there.
question.
And it does seem I might become a meme, guys. It
I'm
might
so
become a
sorry,
meme.
man. I'm so sorry. I didn't mean it. Like when you said it, I just thought it was so funny. Like, man, booty.
Linda, I love you. Thank you for this. All right, let's keep moving here. If you guys got questions for Andy, go ahead and put them in the comments. This one came in throughout the week. I recently had a 0 score on a CT calcium test. Triglycerides equal 42, LP little a 10, but then some scary high numbers on my particle size labs. LDL small equals 275, LDL medium 353, and LDL peak size 219. I exercise, eat right most of the time, etc. Do you think I should be concerned? And would you recommend that I do a stress test in light of all these pieces of the puzzle? Afraid to ask local PCP as I can already hear them saying statin. What's your thoughts on this for this listener?
Yeah, these are a lot too. If we kind of, if you highlight that, that'll kind of give people some numbers to look at, because these are a lot of good, these are a lot of good like fragments of what cardiovascular health looks like. Most often when patients are testing for cholesterol, they're testing for a total cholesterol, LDL, so low density lipoprotein, and HDL, high density lipoprotein, and triglycerides. So usually low density lipoprotein, the LDL, is the big fluffy ones that are a little bit more like Velcro, that are sticky sometimes. And then HDL is like a bumper car that's hard and compact and can help push things along. That's typically why we want good high HDL and low LDL, bad cholesterol versus good cholesterol. Both contribute to a total cholesterol score. Triglycerides usually are bad fats from the liver. That's how I always taught to think about it. And you want lower triglycerides. LP little a, or lipoprotein little a, I look at that as an inherited risk factor for cholesterol. And all of these can kind of contribute from what you naturally inherit. Like, is there a familial hypercholesterolemia, meaning that you inherit just a body that makes more cholesterol, which comes from the liver? Or do you get it from poor nutrition, or even to good nutrition, and you're doing more of a carnivorous diet, where Virginia wants to say hey too. Okay, there you are. Yes. A more carnivorous diet actually can have, like, if you eat a lot of fatty meats, you can actually have increases in cholesterol. But what this question is does that mean anything? Because I have a 0 score on a CT calcium test. So as providers of performance medicine, what we normally do is recommend anybody to get a CT calcium score over a certain age. Usually over age 40, anyone's eligible. You technically can do it earlier. But if you have a cholesterol panel that is off, Virginia, a cholesterol panel that is off will allow us to say, hey, what is actually happening in the body, to where is the cholesterol sticking to anything? Cholesterol does a lot of good things. Cholesterol makes the cell membrane in the form of sterols. It makes all of your hormones. It makes some, I believe, some digestive enzymes. It works with their digestion tract. So you want cholesterol. You just don't want cholesterol to stick to the arteries. And you don't want cholesterol to stick to the arteries where there's injury. So if there's injury, that's where there's an opening. Like if sugar comes in and cuts the artery, it can then need some healing properties, and the healing properties can then all occlude and make an occlusion, and that's where you get the heart attack. So that's this whole thing about why these matter. So Hold on, sweet baby. Hey, baby. So with a CT calcium score of 0, what that means is that there is no calcified plaque whenever there was a CT scan on this patient's heart, which is a great thing. To me, that means that the cholesterol is not sticking to much, even though the LDL particle size is elevated. So on certain cholesterol panels, you can have an LDL small, medium, large. You can also fractionate and look how big the HDL is. Typically, the smaller LDLs are harder on the cardiovascular system. They're more atherosclerotic than the bigger LDL particles. So it's because they can penetrate the wall bigger, and the bigger LDL, like small, medium, large LDL typically bounces and moves down. Small LDL can penetrate and contribute more to atherosclerotic disease. In my opinion, though, cholesterol can contribute to plaque, but whether or not it's calcified means it's hardened plaque. And that's where we typically get worried about it causing an occlusion or breaking off and becoming an embolus and moving to different parts of your body. So with the CT calcium, to me, it's like if you go through the rest of this question, I exercise, I eat right most of the time. I want to be concerned. No. A stress test, there's 2 different ways to do a stress test, and there may be new ways now, but a nuclear stress test and a treadmill stress test. There can be a lot of false negatives with stress tests. That just means, can your heart pump efficiently, and do you have EKG or electrical conductivity changes under stress or exercise? And you can do a nuclear stress test where you're basically ingesting where you're causing an internal stress. So if you wanted to, yes. But would I be worried? No. If you've got really great lipoprotein little a, great HDL, good triglycerides, you eat well most of the time, your CT calcium score is 0, you're super low risk for heart disease. I wouldn't say that a stress test is necessary. I would say if it's going to eat you up because you don't know that data and that information, and you'll sleep better at night because you have a negative stress test, then go get it. That would be the only reason I do it. I think sometimes data points for patients can be either really harmful to the psyche or positive to the psyche. And sometimes patients just need to know, hey, it's negative. And and if it's negative, then you may sleep better. But is it totally necessary? No. I'd say 0 CT calcium score, you're in pretty good shape, because it can test for calcium inside and outside of the artery.
It's such a great question, and I'm glad they asked that, because this is a lot like what going over a Cleveland kind of looks like when we talked about the Cleveland heart panel.
That's the first page of the Cleveland. And 2, you want to look at your health. Cardiovascular risk is also a conglomerate of your other risk, your other metabolic risk in the body too. Bo and I are doing some podcasts together called like Topical Trends. Like, hey, what are people talking about? I know. We said, he came up with the term metabolically challenged, which is hilarious. Most people are metabolically challenged. You might not have like crazy metabolic dysfunction, but it's challenged. I mean, I grew up in the age of Gushers and Fruit by the Foot, and everyone was drinking sodas and having warheads at the pool. Like nutrition is just different now. So I think you have to look at it more from a clinical picture. I wouldn't necessarily be worried. I don't think a stress test would tell you much different. That's a great question, though, because that really gave some great information about what the whole picture looks like.
Such a great question. Thank you for sending that in over email. I see Katie Lynn's in here over from our Bristol office. Katie Lynn, what's going on?
Yes, Katie's at the house.
here for the puppy here.
I'm telling you,
Shelby, so good to see you.
Shelby, and Shelby's birthday was 2 days ago. It was either 1 or 2 days ago.
What? Happy belated, Shelby! I saw you today.
It was the
I didn't
last
say
time
anything.
It's the last time we texted, Shelby. Hold on, and I know I texted you today. It was a happy birthday. Maybe it was on the 14th. That wasn't 2 days ago. It was last week. But still.
Well, Shelby, happy belated.
Happy belated birthday.
Happy belated birthday. Thank you for being here tonight. All right, let's keep moving here. If you got a question for Andy, go ahead and put it in the comments. This is a great GLP-1 question. I listened to your podcast and I've heard Dr. Rogers speak many times about GLP-1s and how they are a game changer. So many people have had success losing weight with them. I am at a loss as to why they don't work for me, and hoping you might could offer some insight and advice. I'm almost 63 years old and have tried Zepbound for 6 to 7 months last year and lost 0 weight. My doc changed my prescription to Wegovy in February of this year, and so far I've lost 0. Actually, I think I've gained 3 to 4 pounds. And there is specifics if you want to get into specifics, but I think it might be more helpful to talk in this kind of in broad terms, because I know there are people out there who have heard amazing things about the semaglutides, the tirzepatides, the Wegovy's, Zepbounds, and then they're not having the success that maybe their friend is. So what's your thoughts on this, Ange, when you see this type of question?
Yeah, first off, I hate this is happening. I know that's frustrating. So like, I just want to put some empathy out there. That sucks. Like you hear about these really wonderful stories where it's like, oh, the first time I took that injection, I lost 10 pounds. And it's not the case for everybody. So I think it's important that we have a couple of, whenever we do these questions, I like to provide the education in case people haven't heard these terms. GLP-1 meds and GLP-1 GIP are the class of incretin hormones. What they do is they sensitize insulin, they direct traffic it's basically they delay gastric emptying, or they slow food going through the gastrointestinal tract so that it signals to your brain that you don't need to eat more. So it works on hunger hormones, directs traffic through the gut, sensitizes insulin, and they are finding that it has a lot more to do with your body than that. They're looking at it for anti-inflammatory properties, looking at it for migraines, sleep apnea. Of course, it works on blood sugar, but also works on weight. Most people with the GLP-1 GIP class are working on it, are usually using it for weights, although people are getting creative with it. Wegovy and was the other one Zepbounds are the 2 brand names for GLP-1 GIP classes. So Wegovy or Zepbound sits around this page, is a combination GLP-1 GIP. So it hits 2 receptors within the gut or the incretin hormones that do all those things we just said. Wegovy just hits 1. It's called GLP-1. There are also compounded versions of these drugs called semaglutide, which is the molecule for Wegovy, and tirzepatide, which is the molecule for Zepbound. People are using these compounds. They are mixed with other materials like L-carnitine, paroxetine, and also L-carnitine, paroxetine are the most common, sometimes methylated B12. The compounds you can actually microdose, custom compound to where you can get a tailored dose, and you can spread it out because you can actually pick your dose. Zepbound and Wegovy are one and done. I just wanted to provide education for those who have not heard of these or wanted more information on these. So I always look at context clues whenever we look at an subtherapeutic response to treatment. So my context clues are 63 years old, so we're probably postmenopausal if this is female, or we're hypogonad if this is a male. We're unresponsive to both these treatments. It's not unusual. I would probably want more information on the dosing, like how far up do we move on dosing. So sometimes it's a dosing issue. Zepbound or Mjaro or tirzepatide can work anywhere from 2.5 milligrams up to 15 milligrams. So sometimes you have to really get to those high doses to see a response to treatment. Usually it's a dose per month. So I would say within 6 to 7 months, you probably reached higher doses. And maybe the switch was an idea to maybe see if we can jumpstart weight loss in a different way. Wegovy goes from doses of 0.25 milligrams up to 2.4 milligrams. So I'd say first off, look at dosing to see, hey, do we achieve or reach a dose that was therapeutic for our body? And 2, I noticed in this context clues, did she say she felt anything? Like I didn't feel like it was working.
Just losing 0 pounds.
Losing 0 pounds and gain some weight.
Yeah.
I would say context clues too. If is there anything else in the way of weight gain? So if we don't have any hormones, then yes. If there's no hormones, then there's no way that we're going to lose weight. You got to have hormones in order to lose weight. So if we're postmenopausal, hypogonad, you got to have the hormone there. 2, I would venture to say, how long has weight been an issue? So if weight's been an issue for decades and decades, we got to get a little bit more creative and how we're attacking that weight, because it's not going to come across overnight. Sorry. Oh my god. Okay, wait. Just hang tight on this. I'm just going to put her outside for a second. I love her, but hold on one second.
Virginia's a star. I tell you what, I'm gonna I'm gonna beg him to bring her back.
She's
Actually,
doing great. Sorry, she's doing great. I could not concentrate. She was
I
like,
was loving
boys are
it.
all over the place.
I was loving it. I know people in the comments are loving it also. I just
I'm sorry. You're like, Wagovi, what? It's just, but sweet Virginia. Okay, she's out now. She's doing good. She's yakking on a bone. She's good. So I would say we need more to the story to see. If I were your provider, I would ask more questions about where are your hormones, how long has this weight been going on, and what is the nutrition and physical activity. I've seen people, if they're missing any body parts, like if they're missing organs, gallbladder removal, hysterectomy, parts of your gut, like people have had colectomies. If any of that's part of the story, then gut disturbances are going to be often, it's going to be hard for you to absorb and modulate what type of food comes into your gut. So that can contribute to weight gain. Looking at thyroid and a suboptimal thyroid, I've tried some thyroid medicine, even if thyroid's not completely normal, but if it's a little bit off, I'd look at thyroid, especially too for postmenopausal. That can really help just spur the weight loss or spur weight moving in the right direction. Some people like the compounds better because L-carnitine is also an appetite suppressant and helps out with weight metabolism or weight management too. So looking at changing up to a compound. Two for you, if you're listening to this question, I would look, there's something called retatrutide coming out, and that's one that hits 3 receptors. It hits GLP1, GIP, and the glucagon receptor. I believe it's called GCR or GCG. People are losing a ton of weight on that. So that's something else too, that it might just be that it's the particular type of molecule that your body just doesn't respond well to. But really looking, people don't give nutrition and exercise enough credit. This is not take the shot and it's all off. Some people it works that way, but most people really have to change up nutrition and really have to be physically active. And also too, to see a nutrition coach. Sometimes too, we think that you just have to eat less and you lose, when really you have to eat enough for your body to maintain the weight. So there's something called total daily energy expenditure and basal metabolic rate. Basal metabolic rate is what your body just burns, just you being you. Total daily energy expenditure is you moving, and you need enough caloric intake in order to get you to move. So if your body feels like it's in starvation mode because you're not eating, then it's going to hang on to weight because it thinks it's in survival. So I would look at probably doing an in-body scan, assessing to see if there's anything else part of the story that might be contributing to weight retention, and addressing each of those issues individually. And 2, you really got to address them individually. So if it's hormones, do hormones first and feel good there. If it's thyroid, then you add the thyroid in. If it's something else, then you address whatever that replacement is. And being very, very kind to yourself. Your brain, I'm telling you, Bo and I talk about this a lot in the room. Your brain has a lot to do with what your physical health does. Cannot tell you how many times people say, I'm just fat. It never works for me. Oh, I mean, 2, you can talk to our sister's a brilliant esthetician. And she has had patients where they come in and they're like, oh, I've tried everything. None of that will work. And she tells them, then none of it will work. If you do not come out and say, hey, I'm going to have a positive attitude and try, not to say that you're doing this, but that is another part of it, is that you got to be really kind to yourself in this whole process. It's not easy. And even our food sourcing too, I feel like our food sourcing is it's really tough to get it anywhere in America unless you're going to the farm, like Brookhaven Farms, where you know the farmer and know that cow. It's tough to get food sourcing that might be easier on weight management. Those are really long-winded answer. Did I answer any of the question?
No, that was super helpful, and I love the way you talked about how these medications work. I'm going to give you a little bit of context here to see if this helps at all, and then we're going to get to live questions here in just a second. They have had 0 side effects from the meds and still have very intense cravings for sweets and salty things. Had a total hysterectomy years ago, had gallbladder removed and a hernia surgery. All routine blood work is good. Thyroid, cholesterol, A1C. Does that, I kind of saw you perfect a little bit.
Yes. Thank you for that. Yes. So having a total hysterectomy years ago, that's part of it. Absolutely. Even if it's partial. So hysterectomy just means removal of the uterus. total hysterectomy plus there's something called TAH-BSO, bilateral salpingo-oophorectomy. Salpingo-oophorectomy just means that you move all the structures down there that are target receptors for estrogen and progesterone. If all those are gone, it's going to be very hard to have weight management if those are not addressed, and especially if we've had years of that accumulating. Thyroid, my encouragement would probably be to do a deeper dive into thyroid and look at a little bit more extensive testing if there's been a free T3, free T4, reverse T3, TSH, and any antibodies associated with it that can help tell a little bit more if you're actually having an active thyroid. And sometimes you just try some stuff to see if weight moves in the right direction. I would also venture to say, like, you said there was also a gallbladder removal?
Yes.
Yeah, so too, that's a gallbladder emulsifies fat. So there's something called bile that comes from the gallbladder and it squeezes in relationship to what goes to your gut. I feel like most people should be on some sort of bioacid salt after they have a gallbladder removal because it does have a function. You can live without it, but it does have a function to your body. So looking at maybe Oxbio 500 and looking at the gut may help. But I do think that maybe waiting for retatrutide to come out may be beneficial. I'm looking at your hormones and looking at retatrutide.
Can you say that that word one more time? And do we know when it's coming out, or is it still kind of up in the air with a
I
release?
don't know. I don't know when it. I mean, I thought it was supposed to be forever, but it's made. I'm pretty sure it's made by Lilly, and they're doing lots of Zepbound and Mjaro right now. So maybe there's not a crunch to get it out, but it should be hopefully soon. You can get it on the internet. I wouldn't do that. It just we don't know what dosing looks like. I've known people to do it. I wouldn't necessarily recommend that off of like a website that sells it, but technically people are getting it and they're seeing response to treatment. I'm just saying they that's all anecdotal. I like usually seeing what the studies look like because even with Mounjaro Zepbound, the studies looked a little bit different than what it was from the Wegovy Ozempics. Like they found some stuff about those drugs that was helpful and useful information. So I always like to see what that looks like first before doing it. But it should come out soon.
All right. Thank you for that, Andy. The great answer there. And thank you for the question that came in through email. Get to the live portion of the show, guys. If you have a question for Ange, I'm looking for you right now. Katie, I see you. And that
We
is probably
are looking for softballs.
Gallbladder question here from Rhonda, who has gotten pellets from JC. I had my gallbladder removed 6 weeks ago. Now I'm having bad acid reflux. I also had hormone pellets from JC office. Could that be doing it, or do you think it's all from my gallbladder? Seems they're having acid reflux. What's your thoughts on this for Rhonda here, Andrew?
This is a good question. So we just kind of talked about with gallbladder, and two, absolutely, I'd say with it being 6 weeks ago, more likely than not, it is from the gallbladder and not from the pellet. Acid reflux is just it's like your stomach basically pushes back against the DEJ. So there is a esophageal sphincter that holds. It's not the DEJ. Yeah, it is. I think it is. There's esophageal sphincter that holds the esophagus and closes it off on the stomach. If there's pressure, then it comes up, and that is acid reflux. You get kind of that burn in your chest right here. I'd say gallbladder might have something to do with that because it's part of the gastrointestinal tract. Yes. It also could just be like, hey, you've had a change in your body. Now nutrition's doing something a little bit different. I would say look at Oxbio 500 from Pure Encapsulations and see if that helps. I would too be kind of kind to your digestive system after removing that gallbladder. Although we're big fat people, we love good healthy fats. It might be too tough on your system to do too many fats right now. So do a little bit more of, like, they call it like the brat diet, like a bland diet, just to be easy on your system first before introducing all those heavy fats, especially saturated fats. Even though those are really good for you and healthy, the gallbladder's really good at emulsifying it, and we don't have that. So yes, Rhonda, I would look at Oxbio 500. I would say probably most likely not from pellets, and probably from having the gallbladder removal. And I would change up the nutrition just a little bit until it eases off. It's a good question.
Thank you, Rhonda, for that. Let me know in the comments if that helps any. I see Debbie from Australia.
Hi, Debbie.
So Debbie is asking, how do you manage hypo during
Oh,
exercise? I do 60-minute treadmill 4 days a week and strength program twice a week. Always get hypo with treadmill. What's your thoughts on this for Debbie here?
this is a really good question. Oh, Debbie, my fellow I don't like to call us diabetics. We're people with diabetes. And clinically proven we're funnier than other people and better looking. So you're welcome, world.
Yes, that's confirmed.
That is clinically relevant. No, but I will say too, just from a psychological standpoint, it's the most frustrating thing in the world. I have had lows, so many lows during exercise. It's so annoying. It's the work because you get pumped up. You're like, I'm gonna do it. I work and I'm gonna do this exercise. And as soon as you get there, you're like, freaking A, it's 50? Like, are you serious? And you can't do anything. Your muscles need that sugar in order to run and to get it to the muscles to innervate them. So it's impossible to exercise while you're hypo. So it's a very frustrating thing. What's interesting though is like this sentence is like teachable. Treadmill versus strength training. Strength training in anything is going to be aerobic versus anaerobic exercise. So strength training is anaerobic. It doesn't require oxygen in order to have that process happen with exercise. Aerobic exercise is treadmill. Aerobic exercise drops your blood sugar. Anaerobic doesn't. It raises your blood sugar. So actually different types of exercises do different things to the body. And when we're on insulin management, we have to account for that. So usually what I do, I'd rather be high than low during exercise because there's a lot bigger threshold, meaning that if I'm going from 120, I only have to go to 0. That's 120 points before it's like there's nowhere to go but 0. 120, there's a lot higher threshold. You can go to 200, 300, 400, 500, 600. So I'd rather run a little bit higher rather than a little bit lower. So I'm usually eating during exercise. I'm usually changing up the basal rate. So if you're on a pump, you can decrease your basal rate by 10 to 20% during the time of exercise. Or if you're on basal bolus, meaning you're giving injections of basal therapy, then eating before. To me, always a rule, I eat a little bit before I exercise,
Yeah.
but that's what's happening. The treadmill is aerobic exercise. It will drop your blood sugar. So prepping for it before with about, honestly, 15 to 30 grams of quick carbs to get it in. Some people will do a quick carb with a buffer, like peanut butter crackers, where there's a little bit of a carb plus a fat. I'm usually quick carbs because I don't do 60 minutes on the treadmill. I don't do that long on the treadmill, so mine's a little bit quicker. But it's a great question. So the answer, Debbie, I would eat before 15 to 30 grams, adjust your basals if you can, and I would focus probably more on doing it for aerobic exercise, not anaerobic. Because I did the thing where I was doing yoga, hot yoga, and I would get my blood sugar would go up because I was adjusting my basal rate to go down, and it's actually more of an anaerobic exercise than it is an aerobic exercise.
Thank you, Debbie, for that.
Science. Look at science. I feel like Bill and I, the science guy.
Look at that. I love this. I saw this. Ashton's in the building tonight. Ashton, what's going on? Andy, stop sounding so dang
Ashton's in
smart.
the house. What? Hold on. I'm gonna play a song for Ashton. Hold on. Let me get that song out for Ashton. Okay. Hold on. We're just gonna we're gonna get something fun. Ash, I'm telling you. Hold on. Hold on.
Yo, tell me what I want, what I really, really want. Tell me what you want.
Okay, we don't want to pay for that song.
Yeah.
We can only play it for about 2 seconds. Only about 2. Ashton is in our Johnson City clinic and also has a day in Kingsport. She's brilliant, funny, and comes from cardiovascular. So she knows that heart better than any of us. It's so fun that we all have these different backgrounds that get to work together too. So that's what Ashton. You're throwing me questions. I'll tell you, one time during a rotation, I think I've told Bo this. I was in the ER, and so I had a 6-week rotation in the ER. And it's like I know diabetes very well. So if you throw a diabetic question at me, I'm most likely gonna know it. The other stuff, I really had to work towards. My answer for everything was check a blood sugar. Like patient presents with blah blah blah, I'd be like, have we checked a blood sugar? And the one time this guy comes in and they thought they thought he was drugged out. They thought he was on drugs. And he looked like it. He was slurring his words. His clothes are a little bit ratty. They made a judgment call. And and I said, his blood sugar's low. Check a blood sugar. And hell if it wasn't low. And I was like, amp a D50. And they gave him sugar and he came back. He was a type 1. I was like, the one time. I even said it in orthopedics. They'd be like, what do you see on this x-ray? I was like, I don't know. He could have diabetes. He could. We don't know unless we check an A1C. He could. That fracture could be from diabetes.
I love it.
But that
I
was very
love it.
sweet, Ashton. I appreciate it.
Ashton, thank you for being here tonight. Foxy Moxy from New York State is asking, why does vitamin C bother my stomach, and what do you recommend here for Foxy Moxy?
Foxy Moxy, this is a good question.
Yeah.
You know, I would venture to say I don't know exactly why specifically vitamin C would bother the stomach. If I would say take it not on an empty stomach, maybe it's without food. I feel like it's more like it's found in more acidic foods, so I feel like it might be a little bit more bothersome to the stomach. But I get bothered by any vitamins if I do not have food and I do not take it at night. So maybe it might be timing of day for you and not the specific vitamin. It also I've tried them all different types of vitamin C, so maybe brands and dosings. I would say maybe hold on it for a little bit and do some natural supplementation through nutrition, so foods that are higher in vitamin C, and then try it with a ton of food, like just stuff that's stuffing your lining so it's not sitting right on the stomach lining, or maybe taking it at night. I do all my vitamins at night, all at the same time.
I do too.
And they're also, and I will tell you, and like Robin would say the same thing on here, like taking them at specific times of the day with or without certain types of food gets the best absorption. So it's not technically correct the way I'm saying to do it. I always feel like with vitamins, it's better in than out, like get it in somehow. So that's typically how I do it. So Foxy, I would say maybe look at timing. And if not, like it might just be that you have a sensitivity to vitamin C, and I would get it through different types of nutrition. But that sucks. And two, maybe even consider doing a vitamin C IV. You can do vitamin C IVs. You have to get a G6PD testing if you're really wanting to have some of that immune booster. And if vitamin C is just not your thing, you can look at alternatives for immune boosters, which will be vitamin D, zinc, quercetin, things that are going to help stave you away from sickness without it necessarily being C.
Foxy Moxy, let me know if that helps. I know I've heard that before, so thank you for asking that question. Real quick, I'm going to put this up from Wayne, because I love you, Wayne. It's his Tuesday night ritual. Is there anyone else in here tonight?
Nice.
This is their Tuesday night ritual. This is my Tuesday night ritual.
Ben, you are very popular.
Let me know in the comments. Thank you, Wayne.
Can we give it up for Ben? Ben, you're a very good host. Like, yeah.
Let's keep going here. Rebecca, thank you so much for this. Where do we purchase the medications you mentioned? I'm assuming you're talking about the GLP1s. I'm assuming GLP1s. Am I wrong, Rebecca? The semaglutides, tirzepatides.
I'll just answer both. So the compounds you get through us, we partner with a compounding pharmacy. There's a specific compounder pharmacy that we use it. He's local. The reason we like him is that he is monitored all the time. So he is to the letter of the law. He gets these molecules from the highest quality resources that he can find, that to a lot of it's from the same company that a lot of these big retailers get it from. So we trust his sourcing. We trust how he makes it. He is to the letter of the law with sterile facilities and how he does it. And two, he's cleared. That FDA comes in and checks out his place to make sure he's doing it right, and he does it right. So that's why we like using this particular compounder, and I feel very safe with getting it from him. So usually it is done through us so that we can write the specific order. When you do compounds, you have to write it in a way that is for a non-FDA approved dosing. So we don't write it for diabetes or for weight loss. We write it for inflammation, metabolic syndrome, joint pain, migraines, PCOS. There's a lot of different diagnoses that these things work for that doesn't necessarily have the FDA approved dosing. And also too, we use it in a way that you can also do it in a way that it needs to be custom compounded, because a lot of the dosings that are FDA approved are one and done and don't work. So that's why we like to have these little smaller doses that are available. Not to say that we use the retail a lot as well, but that's how we do these things. And that is a legal, verifiable form to do these. And so, and you talk to a provider every time. So you do it through us if it's talking about semaglutide, tirzepatide, one of the compounds for GLP1 and GIP management, which also helps with weight loss secondarily. And then, and so if you're talking about butyrate, I think it's Body Bio is one to
It could
do.
be.
Is that right? Okay.
It could be. She could be talking about Butyrate.
Butyrate is Body Bio. Well, I don't think we sell butyrate, do we?
I don't think so.
I don't think so.
Well, I think of HMB, but that's not what we were talking about. I don't believe. Real quick, Andy, I'm
Maybe?
gonna while we're talking about the GLP-1s, I want to get this from Connie Lynn. The hype around GLP-1
Oh,
patches.
HMB is butyrate. We
Okay.
have
Okay, it's in our creatine.
hydroxymethylbutyrate. It's a different type. But we do that for like muscles, don't we? Because it's in
Yeah.
creatine, so it's a little bit different. I would say don't do the HMB, do the butyrate.
Yeah.
Yes.
Hype around the GLP-1
Connie!
patches.
Oh, Connie. You're the best. You're the best. Oh my God. Connie's great. So good to see you. These are good people. Sorry. What's my thought on this? Actually, I don't know anything about GLP-1 patches. That might be a new route of administration for GLP-1s. I have heard of sublingual, I've heard of oral, and I've heard of injectable. So I don't know anything that would be transdermal for patches. I don't know anything about dosing or duration of action. I think anything with route of administration is what your response to treatment looks like. We typically say we try to stick to the injectable. The injectable is getting bypass, you bypass first pass, meaning that it's not just having to degrade through the gut. It's kind of in and you know it's in. And also two, dosing is, we have guidelines on what the FDA approved dosings are. So that helps us out with the, like dosing titration schedules. Same way with oral. There's an oral form of semaglutide. There's a way to do that to where we know what Belsis is the oral form of semaglutide. So we typically stick with those. But GLP-1 patches, maybe someone's doing it in transdermal route and getting good response to treatment. And two, I would venture to say when you're looking at a patch, you're probably getting less nausea or GI discomfort. A lot of patients have that as a side effect from it. So that might be the hype that you're saying is it's not having the side effect profile. But I would say I don't know much about its efficacy. I would say probably injectables are going to be the most efficacious.
Connie Lynn, thank you for that question.
Connie. Oh, Connie.
Let's get to Jerry here from the UK. Shout out to the UK. What's your thought on radiotherapy burns? I'm still waiting for my order of ivermectin paste, but can I put DMSO on it till it comes? Also, can I use red light too while ivermectin is on my skin? And I believe Jerry's going through some radiotherapy with cancer, I believe. So we're praying for you, Jerry.
I'm so sorry, Jerry.
yeah.
That sucks. But also too, just like, yeah, you're doing some stuff that is targeting it from the other side. Ivermectin paste. So now too, I would say, now red light therapy. Just different words here. DMSO is a carrier. It's a carrier substance. And if anybody has more information on DMSO, please put it in here. But to my knowledge, it penetrates, like DMSO is going to make something more penetrable. So when we're looking at like, I want to put DMSO on my shoulder and I'm going to put DMSO with lidocaine and really get it down there, it's going to make it penetrate more. But I believe it's the molecular structure of DMSO that makes it carry into the body a little bit better. There's some really interesting studies in history about DMSO from like the 1950s and 1960s, especially for cancer, that I don't know specifics on. But can I put DMSO? I would be careful about how much you put on, especially for delicate skin. Like when your skin's available, when I'm just saying when your skin's compromised is what I'm looking for, things are going to get in faster. So I would say like even just putting your hand on it, whatever's on your hand is more likely to get penetrated into the skin too if you have open wound sourcings. So if you're in the healing process, I'd be very careful about how much you put on. I don't know dosings on DMSO, but I would almost be careful about that. I would say more yes to red light than DMSO. So red light is going to allow things to penetrate. Same way with DMSO, it's a penetrating thing, but I think that red light's probably a little bit less on the scale of really penetrable like DMSO. So yes, I would say red light is good, and that is good for healing. It's going to be good for your skin because it's innervating some of those cells to regenerate, and that's what we're wanting when we have radiotherapy burns. Ivermectin paste, I'm curious if you're doing ivermectin for an anti-cancer or if you're doing it for healing of the skin. So with radiotherapy burns, there would be two mechanisms here. Is what are we radiating, and are we trying to heal the skin, or are we trying to kill the cancer? So for me, ivermectin would be probably more anti-cancer, less healing of the skin. In my opinion, that would be how I would use ivermectin. I have had people use ivermectin paste in the office on like growths on their skin, and they'll put it on and the growth will fall off. So I've seen that happen with ivermectin paste. But as far as regeneration of the skin, I know you want radiotherapy with anything with burns is you want that skin to come back. And so anything that's going to say you skin usually for healing, you want it to be moist. From my understanding of wounds, I don't know if anybody remembers me getting bit in the face by a dog, and I had this.
Yeah, I do.
Dog
Yeah.
that almost bit my new nose off. I mean, what? Do you remember that? I looked
I
like
do.
Frankenstein. Um, um, two, we had an employee that worked in wound care, and she's like, "You want to keep that thing moist." And
Yeah.
two, I was actually prescribed naltrexone cream. Naltrexone cream helped with scarring. So I did a little bit of like low dose naltrexone cream on like as a scar to help out with scar formation. So I would say yes to red light, keep the wounds moist. Ivermectin paste, I would almost say, depending on the type of cancer that you're going through, I'd almost look at oral ivermectin from an encapsulated oral ivermectin and look at some of the anti-cancer protocols from that. People are doing that in 1 mg per kilogram encapsulated most days throughout the week. And the higher the dose of ivermectin, the more potent, but like for good benefit anti-cancer therapy, but can also have side effects. I would say ivermectin paste, I've seen it more for specific like cancers, like topical cancers. DMSO as a carrier protein for more healing. So I don't know if that helps out. This might be one too that we save on the docket to make sure I get a little bit of a clearer answer for that. But those are the mechanisms. For the four things that we're talking about here, those are the mechanisms of how it works. I would say definitely red light in the meantime. Red light is super healing. And maybe even looking at castor oil. Castor oil's got some, but anytime you have an open wound, you're going to absorb it a little bit more because it's going to the bloodstream more. I'm sorry you're going through that, Jerry.
Yeah, Jerry, thank you so much for that question. I'll put up some comments. There have been a lot of helpful comments here. If I see Lotto, Ivy, I'll put those up in just a second. I just want to make sure we get to as many questions as we can. I want to go to Helen. If I can find Helen's 2 questions, we'll go through these a little quickly here so we can get to a few more people here. Ange, is there a test to check if our body is utilizing hormones properly?
Yeah, Helen, that's a good question. You can do it. There's 3 different testings I would look at. One is just blood serum, like blood serums. Now, this would be a 2-part question. One would be like, is your body making hormones? So you can just test it if if does my body actually make hormones? If you're still having active menstrual cycles as a female, you want to check it around days 19 through 22 to see if you're actually having the peak of estrogen progesterone that you should. That's kind of where progesterone meets estrogen, and that's nice. That's where it tends to be peaked. So I'd say if you're testing for it, actively cycling, days 19 through 22, estradiol, progesterone, testosterone, and FSH. FSH is going to say is your brain talking to the genitalia and making the hormones properly. If I'm utilizing hormones properly, is if you're taking them, you can also test it at any time. The timing matters of when you apply a cream or do a sublingual or do a trit. Some people take oral hormones. The timing sometimes matters. And I believe, Robin might know, I think it's 6 to 8 hours is peak for creams of when you're going to notice if it's most potent. I think more importantly, checking your hormones by blood at the same time each time you draw them. Like I always check it in the morning and I give hormones at night. Will give you a reflection if it's working. There's also a salivary test that you can do. And there's also a urine test called a Dutch test, dry urine testing. So there's 3 different modalities. Providers usually use one that they prefer and know really well. Performance medicine, we're big on blood. So we usually just use blood to test those. But I would say, I would say, depending on what you're doing, if you're giving hormones, I'd say check it at the same time. You do blood. And if you're doing creams and not getting a great response for treatment with blood, I would go to a Dutch or a salivary. And then if you're regularly menstruating and just want to see if your body's making hormones, days 19 through 22 of your cycle, add an FSH. FSH is letting you know if you're in menopause or not.
Helen, I hope that helps.
great
It's a
one.
great question. Real quick for Roel. Andy, my beautiful daughter is 11 years old. What vitamins do you recommend for her before she goes back to school in August? I know this is a very timely here as we're heading back to school. What's your thoughts on here for Roel's daughter?
I'd say this is Roel. It's nice to see you. I haven't got to talk to Roel in forever. So too, I'd say my big thing about vitamins with young people, I'm never like every young person needs a vitamin because their immune systems are kicking it right now. At 11 years old, your immune system should be really cranking. So getting 11-year-olds out in nature, touching dirt, getting their hands dirty, being involved in community, getting sick and then getting over it is better for their immune system than avoiding all that stuff. So I would say that'd be my first thing. My second thing is they've got to eat well. Like if they don't eat well, they're not going to grow. They're not going to feel good. Teaching them good nutrition, which I'm sure you're doing right now, but nutrition is what I would work on first. The 11-year-old Andy, you'd be shocked. The 11-year-old Ben, God, say a Hail Mary right now. Jesus, he was sponsored by Fruit Roll-Ups. Like, Ben was a Dunkaroo, okay? I was a snack pack, he was a Dunkaroo, okay? So, like, nutrition would be, like, her best bet for her immune system is nutrition and sleep and staying active. Like, that is what I would preach to my 11-year-old. Well, not preach to, but as far as vitamins, I think vitamin D is good for anybody. I don't know the standard dosing off the top of my head, but I think anything that has vitamin D in it, probably at 1,000 international units or maybe 2,000 max. Vitamin D, looking at small doses of zinc. I think, honestly, Flintstone vitamins probably has some other additives to it and it's synthetic, but I've seen B12 come up when people take Flintstone vitamins. So just having something in there that's a general low-dose multivitamin that incorporates some sort of zinc, some sort of vitamin D, or some sort of vitamin C is good. If she's up for taking vitamins, that's how I would do it. But looking at probably Flintstones might be my choice too. It's better than nothing, but she's going to get way better vitamins. I think they even have they probably have really good companies now that make kids vitamins. A nice multivitamin, I think, for her is good. And then really hard, I'd make sure she ate well and really slept and got out and got dirty and had fun.
Yeah. Roel, thank you for that. Real quick for Kathy, then I'm going to let you go, Andy. Kathy is asking, hey, Andy, can...
Kathy Gret!
Can stress cause you to have low blood pressure, sugars, and what brings your blood sugar fast? My friend frequently has a 40 or 50 low blood sugar, and it worries me for her. Kathy always asks for her friends, so I really appreciate Kathy
That's so sweet, Kathy.
being here
Kathy is
tonight.
she's very sweet, Kathy. It's so good to see you too. These are good people. Yes, it can. So too. So that's a compensatory mechanism. I would probably call that reactive hypoglycemia. I mean, that's not an exact diagnosis, but technically what happens is that when your body is introduced to any stress, including food that you put in your body's going to react to it. So with hypoglycemia, it seems that your friend would say that she's having low sugar and maybe low blood pressure in response to a stress. So instead of having a glucagon come in, what happens is that when you have stress, you have cortisol. And when you have cortisol, you have glucagon. And glucagon is opposite of insulin. So glucagon is sugar, and insulin's opposite of sugar. So if there's too much insulin that counteracts the glucagon spike or the cortisol spike, you can have a low blood sugar. So I would call that reactive hypoglycemia. Then when most people would get a little bit of elevation in sugar, it's almost like your friend's getting an elevation and then quickly getting an insulin spike that brings it down too much. So she's almost like hyperinsulinemic, or she's got too good. Most people are insulin resistant. She's probably super insulin sensitive. And so sometimes people take diabetes medications for low blood sugar because it sensitizes the insulin. If that makes sense. I've had people that have taken medications for diabetes that should lower your blood sugar actually normalize blood sugar because it stabilizes the insulin response. So that's a mechanism. I mean, even as natural as berberine or as nutrition to where you're like regular. If I were her, I would test my insulin. I would see how much insulin am I doing fasting? What is my C-peptide, which is an active form of insulin? I would see an A1C, which is probably normal or low normal. And then 2, she should always pack herself to where she has, like, what brings your blood sugar up fast is quick carbs, anything that's not going to have a fat to buffer the sugar. So you want really high glycemic index carbohydrates. And she wants at least 15. It's technically 15 grams every 15 minutes. Depending on how sensitive she is, she might need a little bit more. That's a good question.
Kathy,
But to me, that's reactive hypoglycemia.
Kathy, thank you for that. And guys, we're gonna have to put an end to the show tonight. I want to be respectful of Andy's time. I see that we've got a few more questions coming in. So what I'm gonna do, guys, I see Mark's question, I see Teresa's question. And I know Tom, I love you, brother. Thank you so much. Great comments here. And real quick for Foxy Moxy, vitamin C with quercetin is the only vitamin C that Janet can take without upsetting her stomach. So thank you, Janet, for that.
Good, thank you, Janet.
Andy, man, thank you so much for tonight.
This is fun. Thank
this
you.
has been
No,
fantastic.
I appreciate you. Yes, been moderator of the year. Oh my gosh,
Guys, can we show Andy some love in the comments? And we're gonna call it.
I got a song for that.
But don't get us flagged with copyright.
Come on, Ben. I'll only play it for 5 seconds. Like, you'll know this one. Come on. If people really, I'm just going to tell you right now, people really, I mean. Oh, wait. No. Hold on.
Yeah, yeah.
Guys, let us know how Andy did. Give us a 1 to 10. We really appreciate you guys. Thank you, Julie. Thank you, Tom. Thank you, Roel. Thank you, Helen.
Thank you, everybody, for coming in. Y'all are amazing. Y'all are
Andy,
amazing.
You did fantastic, brother. I love you, man. And thank you so much for being on the show tonight.
Thanks. Hey, Ben, thank you. Ben, can we put some comments in there for Ben? Look at that hair. Look at that face.
Look at this. Sherry.
Oh, come on, Sherry.
Ivy and JC with Ivy.
Ivy.
Frida, thank you. Edna was a 10. Thank you, Janet. Edna was a 20.
Oh, yeah. 20? Come on.
That's incredible. That is incredible.
Ben
We've never seen a 20
face in years, and look how clean and clear and under control you are, Ben. Ben has not had a face routine.
Thank you, Tom.
Ever. And look at that face.
Guys,
Ben's never washed his hair a day in his life, and yet it's horse and tail mane.
Guys, after the show, I'm going to take note of the questions we didn't get to. So make sure you come back next week. Tuesday, we will be back next Tuesday, 7 to 8. Please, again, the more encouragement we get for Andy here, he'll come back on the show. He's going to answer more questions. So give him some love in the comments. Ange, thanks so much, man. Thank you for the time tonight.
Hey, thanks. I appreciate you.
Courtney, thank you. Lotto, thank you. Edna, thank you. Ange, I love you.
I love you too. Bye.
All right, brother. I'll see you in a bit. All right, Brad, take us away.
Don't go away.